Good day, everyone. You're welcome to Dr. Boom's YouTube channel. Today, we'll be discussing a very interesting topic of public health concern. It's no other than breast cancer. This is October Breast Cancer Awareness Month, and we thought it wise to bring you this presentation so that we can also do our part in contributing to breast cancer awareness. So, as a way of introduction, we will just be as simple as possible so that we don't bombard you with a lot of medical jargons. So, breast cancer occurs when you have your breast cells, or we say some of the cells in your breast, growing out of control. It is not a death sentence, so we shouldn't be afraid, as a lot of people now live their normal lives and even live long for as much as they want to with breast cancer. But the catch there is early detection. And so we shouldn't worry, as modern medicine has provided offers and ways to fight back this condition. So you shouldn't feel like your life or the life of your loved one has turned upside down if you or your loved ones have been diagnosed with breast cancer. So today we'll walk you through breast cancer, what it is, like I've already given some brief insight as a way of introduction of what breast cancer is in the in the in the in the most simplified form, or lay form, or lay term of introducing breast cancer, so that we can all be comfortable. So there's hope. That is the whole point of this presentation. Whether you have been diagnosed with breast cancer or your loved one has been diagnosed with breast cancer, it is not a death sentence. There is hope. And so we will go on with the presentation. So we look at some risk factors, or what we call in medicine etiological factors for breast cancer. Most commonly includes alcohol intake. A lot of people have this challenge of taking a lot of alcohol. Alcohol not only destroys the liver cells, but can also cause breast cancers. We move over to the next risk factor, smoking. Smoking is another very common risk factor in our environment, as You see a lot of people smoking all over the world. It's not something new. Some smoke marijuana, some smoke cigarettes. These are all risk factors for development of breast cancer. We move over to nulliparity. When we say somebody is nulliparous, person has never given birth to a child before, or even taken in, things like that. Why this is an issue is because there's a hormone called estrogen that plays a role in putting people at risk of breast cancer. But if this the if this growth hormone is halted as a result of pregnancy, the risk of it causing breast cancer is reduced. Not to mention, just to mention the fact that there are some people who we know have given birth to children, but somehow afterwards they still developed breast cancer. Other risk factors may have contributed to it. So that is why we also encourage that, in as much as we are in the age of the girl child empowerment through education and all what the girl child is being encouraged to get to the peak of their career and education and all of that, we must not forget to encourage the girl child to also settle down and have their own families, get married early enough, and start having their children on time. As especially those who are interested in having their own families, wanting to get married and having their own babies. This will also reduce the risk of breast cancer. We also move to familiarity. When we say something, a risk, the risk factor is familiar, that means it runs in the family. A woman whose mother or sisters have had breast cancer is at risk of developing breast cancer, and so must be very, very, very observant and very, very prompt in regularly examining themselves every month. After each menstrual cycle, you examine yourself, palpate your breast as a woman, palpate your armpit areas for lymph nodes swelling, or what we call enlargement in medicine. So please, 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 as women in reproductive age, we must regularly, monthly examine our breast. This is a form of prevention that saves lives. This is what we call the early detection, that says that even before you go to the hospital to do your breast scan and mammogram, that regular self breast examination every month can help you detect breast cancer early enough, so that your life or the life of your loved ones can be saved. We know that some men are not also left out. We've seen some cases of men having breast cancer as a result of maybe their mothers having it, but it's not common, so we won't go there. It's rare, but it happens. So the men too should be careful and also try to examine and take care of themselves. We move over to the next risk factor, apart from familiar and the other ones we have mentioned. That's environmental exposure to carcinogens, cancer causing things, or factors. For instance, being exposed to radiation, bomb blasts, and things like that. Or you are in a place where people smoke a lot. This can put you at risk, even though you don't smoke. This can put you at risk of breast cancer. Another risk factor is obesity, especially in old age. Elderly people in our midst must be encouraged to lose weight at old age so that they are not at risk of developing breast cancer and other conditions like arthritis, just to mention but a few, even diabetes, cardiovascular diseases. So we should discourage obesity at all costs, at any age at all. We also have risk factors like eating salted fish, salted beef, like what we call smoked fish in Nigeria. These foods and things keep you at risk of developing breast cancer. Eating processed food too can make you to be at risk of developing breast cancer. Like people who like buying things from the supermarket, everything, they don't like eating natural foods, natural vegetables. So we are encouraged to take vegetables and fruits regularly, as this also reduces your risk of developing cancers. Also, people who take unhealthy vegetable oil, or what we call groundnut oil in Nigeria, always go for the best, like King's oil, this nice oil, Imperial and things like that, oils like that. They will help you to prevent development of cancers, including breast cancer. So this is just to mention a few of the risk factors for developing breast cancer. They also talk about depression and all of that. When people are depressed, maybe from being separated or divorced, some of them, as a result, maybe start taking alcohol and smoking and are at risk of developing breast cancer. Some singles that are not yet married, out of discouragement or feeling of being hopeless, they can develop breast cancer, where they they start drinking and also smoking. They start drinking alcohol and smoking. They put themselves at risk of having breast cancer. So like I earlier said, whatever situation or state you are in life, don't be discouraged. Just have hope that God is with you and you are not alone. And at the right time, everything will fall in place and you will be fine. So we have various forms of prevention of breast cancer. Like I already mentioned, the early detection, that's a form of primordial and also primary form of prevention, because medicine now is in the age of prevention. We are now into preventive medicine. That is the goal of medicine now, the era of medicine, preventive medicine, where people are able to prevent the development of diseases, because we have come to know that prevention is always better than cure or treatment. So we move over to secondary form of prevention, as when maybe if someone has been diagnosed, you on your own, the person detected a lump or some breast changes, and then reports to the hospital where the person is followed up with scans or mammograms depending on the age of the person. And then tertiary, of course, rehabilitation, that's helping those who are having it, maybe taking care of the breast cancer itself, either through the various management options, which includes surgery and all the treatment options we'll be talking about soon. So, there are 6 main treatment options. More are also on the way as modern medicine is advancing every day. So, new changes, new improvements, new ways of management are coming up. So, we have these various treatment options that include surgery, which we all know is common, chemotherapy, radiation therapy, hormone therapy, targeted therapy, immunotherapy. Each one works differently, but together they offer a powerful defense against these cancer cells. So, there are few types of surgical options. We have the one called lumpectomy. Just think of it as a procedure where the breast is being saved. It's a breast saving surgery or procedure. It's a breast saving surgery. The tumor is removed along with a little bit of the surrounding tissue. And we move over to total or simple mastectomy, where the either the just a part of the breast. The surgery for a mastectomy, the entire breast is removed. Can be one breast, can be the two breasts. But this surgery called mastectomy is the type in which the entire breast, the entire diseased breast, the breast that has the cancer cells growing in it is removed. So, we have modified radical mastectomy. The entire breast and some lymph nodes under your arm are removed to stop the cancer from spreading. We move over to radiation therapy. The treatment uses high energy rays to kill cancer cells. And we have two major types. External beam radiation, in the external beam radiation, a machine directs radiation at the cancer from outside your body. Then we talk about the internal radiation, that's the brachytherapy. Here, a small source of radiation is placed inside your breast near where the tumor was. We move over to chemotherapy, the use of drugs, medications, powerful drugs to kill cancer cells. So, this chemotherapy can be used to treat the whole body or just a specific area. It's a bit tough, but it's effective. We move over to hormone therapy. So, some breast cancers grow because of hormones like estrogen. Hormone therapy works by either lowering your body's estrogen levels or blocking it from helping cancer cells grow. This is a key treatment for hormone-sensitive cancers. Yes, because there are hormone-sensitive cancers, hormone-sensitive breast cancers. Not all breast cancers are hormone-sensitive. That's why you'll be asked to do some check for some markers. So we move over to targeted therapy. Now, here is where the things get exciting. Targeted therapy is designed to specifically target cancer cells with markers like the HER2, a protein that makes some cancer cells grow faster. These drugs attack only the bad cells, leaving the healthy cells alone. Pretty amazing, right? So we move over to immunotherapy, the surprise. And now, so for the treatment that might surprise you, immunotherapy. This is cutting edge. It helps your body's own immune system recognize and destroy cancer cells, even those that try to hide. Think of it as giving your immune system a boost to fight off cancer on its own. Yes, so that's why we encourage eating healthy, taking your fruits and vegetables. These are all immune boosters. Yes, that will also prevent you from developing cancer, even reduction of stress. These are all preventive measures. Stress reduction, stress management, exercising regularly. These are all forms of prevention that can help you stay away from having breast cancer. So apart from you regularly examining your breast every month for breast changes, that's why we encourage monthly self breast examination for any breast changes. For instance, some people may have nipple changes. The nipple may go in, what we call nipple retraction. The breast cancer can make the nipples go into the breast. On a normal day, your nipples are supposed to be pointing outwards, but someone that suddenly notices that the nipple is pointing inwards needs to go report to the hospital as early as possible. And then we also have changes in the breast, what we call orange, like orange peel. The breast skin, the skin of the breast begins to look like orange peel, what we call pudirange. So these are just breast changes that you look out for. Some people can also, going back to the nipple, can have bloody nipple discharge. You just notice that your breast is producing blood. You are seeing blood. You are seeing bloody nipple discharge. Those are risk factors. They are red flags for breast cancer. And so you need to quickly report to the hospital so that you can be properly taken care of. Some people may also find lumps in their breast. Some people may just be a difference in the size. One breast has suddenly become smaller than the other or become bigger. So different changes occur with different types of breast cancers. So that is why these changes will only be detected early enough. If you as a lady, you are sensitive in examining your breast regularly every month after your menstrual cycle, you must examine your breast regularly.
Institute in Corvallis says breast cancer is not the same for everyone. Each individual's breast cancer is different and it affects them in different ways, where it has spread to, how big it is. All of that plays a role in different treatment options. Targeted therapies can be used to treat breast cancer by targeting specific characteristics to cancer cells, such as a protein that allows the cells to grow quickly or abnormally. When breast cancers are evaluated in the pathology lab, then certain stains are put on them to look for the estrogen receptor and the progesterone receptor, as well as a protein called HER2. And whether the breast cancers express those receptors and proteins depends on what treatment we can give them. Researchers and oncologists now know that being able to target a certain aspect of a tumor leads to better outcomes for the patient, because a lot of times those mutations are what's driving the tumor, its growth, its replication, its resistance to dying. And so if we're able to shut that mutation off, then we can shut off that cancer. And in general, we can say that not only is it more effective, longer lasting, but also many times less toxic. And that's an important part of our treatment. However, medical oncologist Dr. John Gross says in cancers that have no positive hormone receptors, including a subtype called triple-negative targeted therapies, don't work. So treatment is often a combination of surgery, radiation, and chemotherapy. Another area of breast cancer research right now is focused on immunotherapy, which these are harnessing our own immune system to recognize the cancer and attack those cells. So, we have made some tremendous strides over the past few years, and there's still active research that I would anticipate that our survival rates continue to improve in over the years without a doubt. It's estimated that 85% of women who develop breast cancer have no identifiable risk factors. That's why regular screening is so important. 3D imaging has had a significant impact on breast cancer screening by catching cancer in its earliest form. And early detection often means less treatment and better outcomes for patients.
So, there you have it. We have talked about the 6 powerful treatment options. We've talked about preventive measures. We've talked about things to look out for. Breast changes still under preventive measures, things you look out for apart from just the lump, the different breast changes, and then what you can do on your own to also help yourself. So each of these treatment options is designed to give you the best chance at fighting and beating breast cancer, because like I said, breast cancer is not a death sentence. A lot of people are now able to live with breast cancer for many years. For many years. They have survived it because they were able to detect it early enough, and management immediately started or commenced. And so don't be discouraged because you have been diagnosed with breast cancer or your loved one has been diagnosed with breast cancer. There's nothing to be afraid of. Breast cancer also is also being healed these days. God heals it. The people go for breast examination and the breast cancer is no longer there. So there's nothing to be afraid of. You have God who is able to heal you of this condition. So I don't think there's anything for us to be worried about. All we are interested in is that let it be detected early, because like we have said, early detection saves lives. So that is the whole aim also of this presentation, as this is October Breast Cancer Awareness Month, like we already said in the presentation earlier. So your doctor might recommend one or a combination of all these treatment options based on your need. But remember, every journey with breast cancer is unique, and your treatment should be too. So talk to your doctor, ask questions, make sure you understand your options, and most importantly, never lose hope. If you have any concerns or side effects from your treatment, be sure to let your doctor know, please. Together, we can fight breast cancer. Thank you very much for listening, and we'll be expecting your comments, your contributions, your questions in the comment box below. Have a great day. Thank you.